I'm Dr. Kevin Campbell here in San Francisco at Heart Rhythm Society 2014 Annual Scientific Sessions. I'm with Dr. Suneet Mittal, one of the authors of one of the most fascinating trials that we have seen presented here today. So your trial on remote monitoring was really very, very important and may change the way we do things. Tell us a little bit about what you think the most important findings from this trial are.
Yeah, thanks, Kevin. As you know, all currently implantable devices are capable of remote monitoring. There's been one prior study suggesting that in defibrillator patients, those who are in remote monitoring have a better outcome as assessed by survival. What we wanted to address in this study were a few issues. One is we wanted to know, do pacemaker patients derive the same benefit? We also wanted to know, does it matter how often you're engaged with remote monitoring when it comes to survival benefit? And the third thing we wanted to do was determine whether we can determine who is or is not using remote monitoring. So this was a very large study. We had the opportunity to look at more than 260,000 patients. 43% of the patients actually had a pacemaker implanted, and we found a number of very interesting findings. First is we did see that if you were using remote monitoring, you live longer than patients who were not using remote monitoring. Interestingly, pacemaker patients derive the same type of benefit as was previously seen with defibrillator patients. But one of the really novel findings here was that not only did it matter whether you were using remote monitoring, it mattered how often you were using remote monitoring. So people who are using remote monitoring more than 75% of the time in a year actually live 2.4 times greater than individuals who are never using remote monitoring. And so that really suggests that it's really our duty as electrophysiologists to get as many of our patients with an implantable device on remote monitoring as possible.
That sounds like, to me, a real practice-changing finding, and I think that all electrophysiologists may benefit from this. If you had one take-home message for all the EPs in the world, what would it be?
I would say that the signal for the benefit of remote monitoring device patients seems to be very clear, and now it seems to be confirmed in 2 large mega cohort studies. And really, I would say that if you're going to implant a patient with a device, irrespective of whether it's a pacemaker or a defibrillator, I would highly encourage you to have the discussion with the patient, get them enrolled in remote monitoring, but more importantly, encourage them to be highly adherent with remote monitoring use.